minutes about your experience and why you decided to come almost incognito today to really advocate on behalf of the School Allergy and Asthma Program Management Act.
So it was probably a little bit easier for me because I had retired from my regular full-time nursing position. I'm a master's prepared nurse, so I do know what I'm doing. But I was working 2 days a week as a school nurse through a contract agency with the city of Baltimore. And at the time I was working in a high school, and I don't know how many of you realize that high school students do not follow the rules, but they don't. And Baltimore requires that all the students who have any kind of medication, including Tylenol, must have a doctor's order in the school health unit. There were 400 students in my school. 20% of the students in Baltimore, of school-aged students, have asthma, and I had 0 doctor's orders in my health unit. So the student got very excited, was exercising, dancing in the gym because they had gotten measured for their caps and gowns. She was a senior. Her inhaler that she had at school was locked in this gym teacher's office inside of his desk, which was also locked, and he was not available. He was out sick that day. So the janitor, I know it sounds like bizarre, but truly the janitor was also out sick. And so they're trying to find the keys as this person is having an extreme serious asthma flare-up. They can't find the keys. They've called 911, but as often happens in Baltimore, the dispatcher's kind of screwed up. And so 911, the ambulance is not coming. She's been unconscious for 5 minutes. I say out loud to the world, to the principal who was standing there, get me an inhaler, I don't care whose it is. And she got me an albuterol inhaler because they're all on albuterol. I administered it, and what was surprising to me was that when I wrote my medical incident report and I told the person at the public health department that I had done this, she said, well, how did you administer it to somebody who's unconscious? It's like, well, she's not dead, she's still breathing, and she's going, so I just put it in, and within 3 minutes, her respirations were 24, and within 5 minutes, she was opening her eyes and looking around like a dazed rabbit. So I saved her life. By the time the paramedics got there, she was sitting in a chair talking to her mother. I wrote a medical incident report and was fired. So I am on a quest not to get my job back. I don't want to work for them anymore. But I do want to change the system because I cannot be the only nurse that this has happened to. I think the others just lie and don't write the reports. So.
Thank you, Elaine. Number one, thank you for saving that child. Number two, thank you for holding to your convictions and doing the right thing even when it's hard. What I have found is that when we as a community do the right thing, even when it's hard, when we stand up, when we raise our voice, when we advocate on behalf of those who have no voice, we make significant change, and you guys did that today. So thank you so much for being here and for actually stepping out in faith and following us to really accomplish great things. We will keep you updated. We will provide a monthly update through our electronic newsletter of what's going on with these legislations and how things are advancing and moving. So please stay connected to Allergy and Asthma Network, and I hope that you all circle the date on your calendar. We'll be sending it out soon for 2020 because it will be our 35th year as an organization. It will be our 23rd year here on the Hill, and we would love to see you all back and have additional people join us. Each year at this reception, it's a very special time to also recognize the Environmental Protection Agency's Leadership in Asthma Award winners. And so tonight I'm going to invite to the podium Dave Rowson. David Rowson is the director of the U.S. EPA Indoor Environments Division. His office is responsible for protecting public health from poor indoor air quality in homes, school, offices, and other building types. During his more than 30-year career at the EPA, Dave has helped lead the development and implementation of several important public health initiatives, including radon, comprehensive asthma care, healthy schools and homes, and international programs on indoor air. And I know he's going to highlight the programs that we are so proud of and are so appreciative of the work they're doing at the local level. Welcome, Dave.
Well, hello, everybody. Hello. It's nice to see all of you. And officially, I can't endorse your advocacy work on the Hill. And congratulations and thank you for all the work that you did today. It is remarkable, the number of senators' offices and representatives' offices you were able to visit. I'm not sure you guys have ever had that. It's remarkable work you've done every year, but that is amazing.
It's a record-breaking year.
Yeah. And it's wonderful, and there is important work to do on the Hill, and we have a chance to do that ourselves. We do too, but you are much better positioned for that. Your voices ring differently than folks from federal agencies. Oops.
I'm so short.
And so thank you for that work. I also want to thank you for a couple things that I feel sort of affirmed about today. One, Tanya, you appreciating the work that EPA does in this area. We have a unique role in trying to help foster effective asthma care and stretch the work that many of you are doing and leading, and showcase that and highlight it to try and produce more of that kind of work. Feeling very affirmed by that. And Elaine, your remarks, I have 7 children, and so your remarks that teenagers don't follow rules was very affirming for me too. I feel like, okay, I'm right in the middle of the way things are supposed to go. It's a pleasure to be part of this celebration tonight. The partnership with Allergy and the Asthma Network over the years has been, I think, one of the most gratifying and effective partnerships we've had. My program is a non-regulatory program. It's a different kind of program at EPA. You probably think mostly about EPA regulating various entities and in industry. Our program is a little bit different than that. We're focused on improving indoor environments to improve health outcomes and help for people, particularly those who are disproportionately impacted. And so a lot of the work we do is through partnerships with states, industry, and most importantly, nonprofit organizations who have missions that align with ours. And the partnership with Allergy and Asthma Network over the years has been a remarkable one, and where we have done lots of great work. And the way I think of it is, you've done lots of great work that we've been able to help support, and we're proud to be affiliated with you as an organization. In particular on asthma, we are trying to spread the best practices that are out there for comprehensively helping folks with asthma, paying attention to the critical medical issues around it. But the unique niche we have is also paying attention to improving indoor environments, either broadly us trying to improve environments where people with asthma live, but also helping people who are dealing with asthma be positioned well to advocate with the people they engage with to have the environments they're in be improved. And that goes everywhere from having their own asthma action plans where they're paying attention to reducing exposure to triggers and understanding the important role that plays, but also so they can effectively engage with school personnel, parents when their kids are in daycare, where people work, in order to get the right protections and improvements in indoor environments to help manage the asthma and reduce poor health outcomes from asthma. So that's the unique role we play, and part of the way we go about doing that is identifying great programs that are doing great work in this area, and that's what tonight is about. Our program, I'm just going to say a little bit about it so that as you're thinking about what we do at EPA, you'll feel good about it, because that's not always the way EPA is viewed. But there's some great work that the people on my team at EPA have done over the years, sponsoring some of the seminal research that was identifying what are the key things you need in community-based asthma programs in order for them to achieve great outcomes. And did that work with the University of Michigan Department of Health, have collaborated with CDC to identify that. And from that comes our focus on some of the key things that great programs are doing that we're trying to spread. And so tonight we want to recognize some of the programs that are doing that kind of work. And our hope is both tonight and as we do our work, and I was talking with the award winners just a little while ago, that the way this works is we give them an award recognizing the great work they do, and then from here on out, for the rest of their careers, they have to help us by delivering webinars, mentoring other programs, serving on a community of practice we have that's trying to advance the work. And so we took their pictures today so we know where they are, and they think it's for the award, but it's for other reasons. But the award winners, like our partners, are critical components as we think of delivering our program. Is we're actually tapping into the expertise of external partners who do the great work, and the folks who deliver healthcare at the community level in order to advance this work. So we are very appreciative for this, and let's move on to recognizing them. Real briefly, it wasn't just me and my staff that picked these award winners. In fact, we assemble an expert panel that includes multiple federal agencies, nonprofit representatives, and former award winners that have a very thorough evaluation process where they review all the awards and within that select the ones that rise to the top. So the selection of these are by experts in the field representing agencies across the federal government and folks in the health and medical community that know what good asthma care looks like. Tonight we're going to salute 2 community-based programs and a healthcare provider who have helped advance quality asthma care in the nation and serve and are going to serve over and over and over again as mentors to help other programs succeed. So let me start with in the healthcare provider category. The winner is Mobile Care Chicago, and accepting the award is going to be Matthew Seymour. Matthew, I'm sorry. Congratulations, Matthew. Do we know which one it is? Here we go. Congratulations. I'm going to read a little bit. You have to stand up here and listen to this, okay? You have to read about you. Mobile Care Chicago provides free access to specialty medical care, including for asthma with children across Chicago. Started in 1998 by 4 physicians wanting to address cost and transportation, 2 of the most commonly cited barriers to asthma care, the program began offering free care in the highest need neighborhoods from mobile clinics in converted Winnebago RV vans. The program has since grown from a partnership with 2 Chicago public elementary schools to 45 Chicago public schools, parochial schools, and Head Start programs operating state-of-the-art mobile care health clinics. Mobile Care's comprehensive asthma management program, which is the thing we're really after, is the comprehensive asthma management, provides in-home assessments and a wide range of supplies tailored to address in-home asthma triggers, including furnace filters, cleaning supplies, and IPM. The program has seen a 50% decrease in school absenteeism and emergency department visits, and a 3-fold return on their investment. The reduction in hospitalization rate alone has saved the local healthcare system at least $156 million during the past 13 years. Mobile Care's early intervention to provide mobile health care in hard-to-access and low-income communities has encouraged action and change in the surrounding Chicago communities to provide further asthma relief for thousands of children. And that last point is I think the most important point. It matters, and you hear that's a big focus, is kind of the economic benefits. And one of the really remarkable things when you pursue comprehensive asthma visits and you move the kinds of care kids need from, and you guys know this, I'm preaching to the choir, from hospitals into people doing prevention on their own in an enabled way is a remarkable thing. But in the end, what we're talking about is kids and adults with asthma living different kinds of lives when we provide care the right way. And we know how to do that, and your program's a great example of that. Thank you very much. We have two winners in the Communities in Action category. The first winner is the Omaha Healthy Kids Alliance, and accepting the award for them will be Anthony Vargas and Ian Sheets. Omaha Healthy Kids Alliance is a children's environmental health organization dedicated to improving children's health through fostering healthy homes. OHKA developed the Asthma In-Home Response, Project AIR. Every good program needs a good acronym. In fact, you can't be successful without one. And it serves children ages 18 and younger who have an asthma or asthma-related diagnosis. Project AIR's mission is to help reduce in-home hazards for children with asthma in the Omaha metropolitan area. By reducing in-home hazards, AIR works to improve the quality of life for children with asthma and their families by educating them on indoor environmental asthma triggers, empowering positive behavior changes, connecting them with low-cost supportive solutions, and supporting them by providing free construction services. Project AIR evaluates the program performance outcomes under 4 criteria: severity of asthma, quality of life, environmental health of the home, and behavioral changes. To assess how and where the program can be improved, Project AIR also examines internal measures such as cost per intervention, cost of supplies, follow-up rate, and dual enrollment rate. The program not only provides great services, they have an outstanding operation and business plan for how they do that in the best way possible, which is a real key thing if you're going to have a sustainable enterprise. And one of the things we pay attention to as we're recognizing programs is their sustainability. After 12 months, Project AIR noted a significant decrease in symptomatic days, fewer missed school days, fewer emergency room visits and hospitalization rates, and a decrease in medication usage. Additionally, an evaluation of Project AIR return on investment showed for every $1 invested in a family in their home, nearly $2 return was made. So not only are you getting all the health and life improvements for the patients and their families, actually saving money while doing it. It's a remarkable thing, and we know how to do this. Project AIR integrates a collaborative approach to asthma intervention and diverse funding sources to create positive change in the Omaha metropolitan area. The program's success has introduced new partnerships and improved outcomes throughout the asthma community in Omaha. It's fantastic work. Congratulations. And the second Communities in Action winner is the Rhode Island Department of Health, and accepting on behalf of the Rhode Island Department of Health is Julian Drebs. I was in Julian's neighborhood just a couple weeks ago, taking my son on college visits up in New England. And turns out I've spent all kinds of time in where Julian is, and I love it up there. The Rhode Island Department of Health Asthma Control Program serves children within the age group of 0 to 17 in high poverty urban cities throughout the state. The program partners with organizations like Hasbro's Children's Hospital, St. Joseph Health Center, New England Asthma Regional Council, the New England ARC up there, United Healthcare, and the Green and Healthy Homes Initiative to deliver care through a collaborative approach featuring linkages between healthy housing, the healthcare sector, and other regional collaborations. You'll have heard a theme in the 3 award winners here about the partnerships that they've developed, and which are critical to both the delivery of care, being teamed with folks that have good access to people who are suffering with asthma, as well as in terms of the funding and sustainability of your program, to be in partnership with key organizations, and it's a real critical component of the work of these 3 award-winning programs. The Evidence-Based Home Asthma Response Program, HARP, which uses certified asthma educators and community health workers, conducts up to 3 intensive in-home sessions as part of their services, including tailored environmental services. During the sessions, the educators and community health workers provide tailored environmental education and environmental services, including extensive environmental assessments, intensive asthma self-management education, and cost-effective supplies to reduce asthma triggers. HARP's community health workers reported reductions in environmental triggers, including mold, pests, dust, pets, tobacco, smoke, and chemicals. In addition, using hospital claims data, the program was able to show a 75% reduction in asthma-related hospital and emergency department costs for HARP participants. And for every $1 invested in HARP participants, the program realized a $1.33 return on that investment. The program recently expanded to provide HARP visiting services statewide for Medicaid-enrolled children, which is a fantastic partnership as well. Congratulations. Thank you. And I just want to highlight that Julian is still standing, even though he has been teamed with our community of practice now for how long?
About a year and a half.
About a year and a half, and you survived that so far. So that's good news for you guys. Yeah. Thank you very much. Congratulations again to this year's winners. If you want to learn more about their stories and the stories of the other 43 programs we've recognized over the last 12, 13 years, something like that, 14 years, you can, who we consider our Hall of Fame, you can visit asthmacommunitynetwork.org, which is the online network that we have of community-based asthma programs. There are about 1,100 programs that participate in that online network. If you're not a member of that already, we'd encourage you to be part of that, and I can hear their stories there. Thanks. Enjoy the rest of your time here.
Thank you so much, Dave, and congratulations to the winners. It's been a pleasure to have you all with us over the day, and certainly thank you so much for being here and allowing Allergy and Asthma Network to be a part of this celebration of the EPA Leadership Award winners. You know, as we come to the close of our 22nd annual Allergy Asthma Day on Capitol Hill, I just have to take a moment and once again thank not only our sponsors, our industry partners that are so valuable in making sure that we can continue the work and the mission of Allergy and Asthma Network every day. So let's give them a big round of applause. Thank you so much. They're all listed on the posters, and again, if I start going down the list, I'll miss people, but we've had such great support from the industry, and that's really why we can continue to carry the mission forward. But then I don't want to miss this opportunity to really thank a couple of very key integral people to this day and the event. And again, I've heard nothing but exemplary things about Soapbox and our partnership with them. So the team is not here tonight, but again, Charmaine and her leadership in working with them and making this day so successful. The rest of the staff, Allergy and Asthma Network staff, if you guys will all wave, all of my team. So this is the most hardworking, just impactful group of 12 people that I have ever had the privilege to lead and work alongside. And I love you. I appreciate you. Thank you for making yet another great day. We call them my work family because that's what they are. They're my family. Our board of directors, we have several here tonight. John Tucker, who's our chairman of the board, Gail Higgins, Kristen Buckley, Tony Cook. We have so many board members that gave of not only an hour this evening, but their full day to be here and to advocate on behalf of the millions and millions of patients that we represent. That is what a board is all about. So thank you. Thank you. Thank you for your support. And then as we close, the truth of the matter is this day means nothing unless you show up, unless Allergy and Asthma Network shows up. And that is patients living with allergies, asthma, eczema, AARD, related conditions, rare immune deficiencies that no one has a voice for. And yet we all come together on one day to raise that voice, to say, this should not happen. People should not die from diseases that we know how to diagnose, we know how to treat for the most part, for the vast majority of people, and that, again, we should have access to those treatments. And so I hope that you feel that as you leave tonight, you feel empowered. You feel empowered as patients, as caregivers, as healthcare professionals who work in this space, as simply patient advocates, because that truly is what we did today. And so, again, it's the start of the work. We have still so much more to do, and we look forward to partnering with you to continue to advance the mission so that someday we can say, we knew this thing called allergies, we knew this thing called asthma, we knew this thing called AARD, but we figured it out. Life-threatening allergies, anaphylaxis, a thing of the past. Can you imagine that day? I can for my children and my grandchildren. So thank you for being a part of that, and safe travels home, and we look forward to seeing you next year. Take care.